Thalassemia. Patient education.
Good day, Fawn. How are you?
Good morning, Mew. I'm fine, and you?
I'm doing well. Thanks. What are we discussing in this episode?
Educating thalassemia patients and carers.
Do we need to educate both patients and carers?
Yes. Many thalassemia patients are children and young adults. They may not be able to care for themselves. Their parents or siblings may have to take responsibility and provide care when needed. Firstly, emergencies.
Emergencies in thalassemia.
Yes. There are conditions that may require emergency care in thalassemia patients, such as heart failure, sepsis, arrhythmias, embolism, and bone fractures. These conditions may present with breathing difficulties, abdominal pain, back pain, and lower limb pain.
I see.
The next one is lifestyle modifications. Particularly, plenty of planning for frequent hospital visits, blood tests, missing schools or colleges, unable to play like a healthy adult, adjusting to regular intake of medicines and surgeries. They have to plan for a healthy diet. For people living with thalassemia, foods high in iron may need to be consumed less to avoid iron overload.
Does that mean they have to be cautious when consuming red meat?
Yes. The next one is about vaccines. They have to understand that thalassemia people are prone to infections and their hygiene and vaccination must be up to date, especially after splenectomy.
Does that include COVID vaccine?
None of the COVID vaccine clinical trials included thalassemia patients. However, there is no contraindication for thalassemia patients getting COVID vaccines. Unless there are underlying allergies to vaccines, COVID vaccines are safe to take.
Interesting.
Thalassemia patients need physical activities, but they must not do vigorous exercises. Walking and low-level gardening activities are encouraged. However, running, swimming, bicycling, and playing sports need caution and supervision.
How about going to the gym?
Mild exercises that do not stress the joints are accepted.
I see.
Moving on, all thalassemia patients need family support, and social activities are encouraged to reduce the psychological impact and improve emotional well-being. It is important to develop a supportive network or group to express themselves and avoid isolation.
Can thalassemia patients pet animals like dogs and cats?
Why not? However, they have to be mindful that pets require attention and care too.
Can thalassemia patients get married and have babies?
It is a very good question. Yes, thalassemia patients can have relationships and get married too. However, they need genetic counseling before planning to have babies. If a beta thalassemia carrier is married to a normal genotype, the possibility of having a child with thalassemia carrier status is 50%, and for a baby with thalassemia major is 0%. This is one of the many possible scenarios, and genetic counseling and in vitro fertilization techniques can help to have normal babies.
You mean thalassemia patients can have normal babies?
Yes. The recent advancements in assisted reproductive techniques have a method called pre-implantation genetic diagnosis, in which they analyze one of the blastomeres from an embryo and determine the phenotype. If the phenotype is normal, they will go ahead and implant and deliver a normal baby.
Wow. Very interesting. Thanks for the information.
You are welcome. Please do read the relevant textbooks and lecture notes.
I will. Take care and bye.
Bye.